Genetic predisposition. Am I at risk for colorectal cancer? Have you ever wondered if your family history might be influencing your risk of developing colorectal cancer? It's a question many people ask, especially if relatives have been diagnosed at a young age or if there are multiple cases in the family. Genetics can play a significant role in your risk, but understanding how helps you make informed decisions about screening and prevention. Genetic predisposition means inheriting specific gene mutations from your parents that increase your chance of developing colorectal cancer. While everyone has some baseline risk, certain inherited gene mutations can dramatically raise that risk. The most common inherited syndromes linked to colorectal cancer are Lynch syndrome, familial adenomatous polyposis, and mutie-associated polyposis. Lynch syndrome, also called hereditary non-polyposis colorectal cancer, is caused by mutations in mismatch repair genes. People with Lynch syndrome can have up to an 80% chance of developing colorectal cancer during their lifetime. These cancers tend to occur at a younger age than usual and often requiring earlier screening. Familial adenomatous polyposis involves mutations in the APC gene, leading to hundreds or even thousands of polyps in the colon and rectum, often appearing in childhood or adolescence. Without treatment, nearly all individuals with FAP develop colorectal cancer by age 40. Mutie-associated polyposis is another inherited condition, caused by mutations in the mutie gene, which also results in multiple polyps and increased cancer risk. Family history is a key indicator. If you have close relatives like parents, siblings, or children with colorectal cancer or polyps, especially if diagnosed early, your risk may be higher. Having 3 or more relatives affected or seeing cancer develop at a young age in your family raises suspicion of a hereditary syndrome. It's important to remember that most hereditary syndromes are inherited in an autosomal dominant pattern, meaning there's a 50% chance of passing the mutation to each child. Some, like mutie-associated polyposis, follow an autosomal recessive pattern, requiring 2 copies of the mutated gene for increased risk. If you're concerned about your family history, talking to a healthcare professional or genetic counselor can help. They may recommend genetic testing to look for mutations in known colorectal cancer-related genes. Identifying a genetic predisposition early allows for personalized screening plans, which might include starting colonoscopies in your teens or 20s. In some cases, preventive surgeries or more frequent surveillance can significantly lower your risk. It's also vital to remember that genetics is just one piece of the puzzle. Lifestyle factors such as diet, obesity, smoking, and alcohol consumption also influence your overall risk. Age is another factor, with most colorectal cancers occurring after age 50. If you have a family history or known hereditary syndrome, early and regular screening is your best defense. Always consult with healthcare providers to develop a plan tailored to your personal risk profile. Being proactive about your colon health can make a real difference in preventing colorectal cancer.